Hello and welcome to this session on 4 tips for narrowing your search. Have you ever done a search in PubMed or another database and gotten way too many results? If so, this video will help. We'll cover 4 tips to reduce the number of results, including the use of filters, quotation marks, title searching, and the addition of a concept. Note that you can use these tips in any order, and you may find 1 or 2 will be enough to narrow your results. We'll explore these tips through the use of this question. In patients with resistant hypertension, what is the effect of exercise on reducing blood pressure? So let's go to PubMed and try out our search. We'll go to PubMed through the HSL's website, and then we'll type in our main concepts. Note that physical activity is a common synonym for exercise, so I'm separating with the word or and including them in parentheses. And I'm separating my main concepts through the use of and. When we do this search, we get more than 2,000 results, so it's time to look at our first tip. One of the easiest ways to narrow our searches is to apply filters, which enable us to zoom in on specific publication dates, languages, study designs, and more. So let's apply limits to our search. Note that the limits in PubMed are on the left-hand side. First, we see a graph of publication years, and from our topic, we can see a lot of research in the past 10 years or so. So we can go ahead and limit to 10 years. And we can also limit to the English language. Note that you will not want to limit to free full text or full text, as you'll miss out on articles the library provides through other resources. Also, be careful when applying some of the other limits beyond publication date and language, as those require an indexer to have read the articles and to mark them as a particular limit, for example, as a clinical trial. Note that our search is now down to 865 results. Let's move on to our second tip. Another way to narrow a search is to include quotation marks around phrases so that PubMed searches the words together. Our search has 3 phrases: resistant hypertension, physical activity, and blood pressure. So let's add quotes to our phrases and see what happens. Note that in PubMed, we're seeing the word resistance applying to training rather than hypertension. So this is a good visual cue as to when it may be a good idea to use quotes around a phrase so that we would get resistant hypertension and not resistance training. One thing to keep in mind, though, is that whenever you add quotes around a phrase, this automatically stops PubMed's automatic mapping feature to medical subject headings. So we can check that by going to the advanced search feature and looking at our search details. We'll want to see if any of our terms have been automatically mapped to a mesh term. There is no mesh heading for resistant hypertension. Instead, it's the broader hypertension term. There is a mesh heading for exercise and exercise therapy, but not for physical activity. Note that there's also a mesh term, here it is, for blood pressure. This tells us that if we wanted to search blood pressure as a phrase, we would want to be careful because we will miss out on this medical subject heading. So let's edit our search. We can go to Actions and then say Add the query to the query box. And we'll add quotes around resistant hypertension and around physical activity. So we can add quotes around blood pressure, but what we'll want to do is also search the mesh heading. So I'm going to put a parentheses here and then say to search blood pressure as a keyword or search blood pressure as a mesh term, and I'll close my parenthesis. And now when we run the search, we get 46 results, and we're seeing resistant hypertension together as a phrase, as well as blood pressure together as a phrase. So let's move on to our next tip. Although we're already fairly narrow in our search, that may not be the case for all searches in the future, so let's consider narrowing through the use of a title search. You may note that in our search, perhaps the most relevant articles are those in which resistant hypertension are in the title. So let's go ahead and search for that phrase in the title. We can easily do that right here by inserting a square bracket and the letters TI for title. This tells PubMed to search for resistant hypertension in the title. And we're now down to 26 results. Note too that you can do title searching in the advanced search feature by choosing all fields, selecting the drop-down arrow and choosing title. I chose to do this way since I already had my search built. So let's move on to our fourth and final tip, as I'm sure you're curious what that one is. Our fourth and final tip is to narrow a concept or add another one. For example, we could add a concept for age by searching for older adults, or we could add the concept of primary care to see what research is done in that setting. We can also narrow by the type of exercise by searching for aerobic exercise. So let's add the term aerobic to our search. I'm going to go ahead and just search for the word aerobic at the beginning and use the word and. So this tells PubMed that take our entire search we had before and make sure it has the word aerobic in it. And in this case, we're narrowed to 24 results. We could keep narrowing our search, but perhaps we've done enough work here to realize that we can feel pretty confident that we can take the time to go through these results and see which ones are the highest level evidence. So in the future, if you have questions about your searches, whether narrowing them or broadening them or anything in particular regarding searches, there are several ways you can reach out to us. You can check our residence guide, you can ask a librarian from our website, or feel free to contact your liaison librarian.